Thank you for joining Cancer Support Community Atlanta for the Tell Me More series. This program is focused on medications and sleep and is facilitated by Kelly McCrum with Northside Hospital Cancer Institute. For more information on other installments of the Tell Me More series, please visit Cancer Support Community Atlanta's website, cscatlanta.org.
Hi, I'm Kelly McCrum. I am the clinical oncology pharmacist at Northside Atlanta, and today I am going to be discussing medications and sleep. So today we will define sleep disturbances and identify chemotherapy's effect on sleep, review some supportive care medications and their effect on sleep, identify appropriate timing of medications to reduce interference with sleep, review herbal supplements that may have benefits in sleep, focusing on melatonin and chamomile, and discuss over-the-counter medication options, and briefly identify medications that may be prescribed for sleep. Insomnia and daytime sleepiness are prevalent and often chronic problems in cancer patients, with sleep-wake disturbances affecting between 30 to 60% of patients. Many patients are affected by hyperinsomnia, which is the inability to stay awake and alert during the day, and by insomnia, which is defined as habitual sleepiness or inability to sleep. Many patients undergoing active cancer treatment, many of these patients will feel as though they're resting or sleeping even more than they did before, but their sleep patterns are often disrupted, resulting in poor sleep quality. This then leads to daytime fatigue and exhaustion. Fatigue is reported in as many as 40% of cancer patients at the time of diagnosis, up to 90% of those treated with radiation, and up to 80% of those treated with chemotherapy. Fatigue may continue for months or years after completion of treatment in about a third of survivors of cancer. Numerous factors have been invoked to explain the occurrence of fatigue and sleep disorders in cancer patients and survivors. Factors associated with the development of fatigue and disrupted sleep include a type of treatment, for example, surgery, chemotherapy, radiation, and immunotherapy, comorbid conditions like anemia, malnutrition, heart failure, ancillary medications, anxiety, depression, physical inactivity, and pain. Oftentimes, chemotherapy drugs cause patients to feel tired and sleepy throughout the day. Therefore, patients receiving chemotherapy end up napping or sleeping during the day, leading to difficulty sleeping at night. Anemia, a condition of low red blood cell counts caused by chemotherapy, may be contributing to fatigue. A recent review of 18 clinical trials found significant improvement in health-related quality of life, particularly with regard to fatigue in cancer patients once anemia resolved. Some chemotherapeutic agents cause neurotoxicity, which could induce neuromuscular weakness that might contribute to feelings of fatigue. However, the interactions of neurotoxicity and fatigue can be complex and sometimes unavoidable. Nausea and acid reflux can also contribute to disrupted sleep and fatigue, leading to difficulty falling asleep and staying asleep. Patients receiving treatment for cancer often show diminished physical and functional well-being as compared with patients not receiving treatment. Maintaining an exercise program of moderate intensity individualized to the patient's specific needs has been shown to reduce fatigue significantly both during and after treatment. Furthermore, numerous studies indicate that inflammation and immune response can influence sleep. Tumor growth and therapy, including chemotherapy, immunotherapy, and radiotherapy, typically are associated with inflammation and the production of an array of sleep modulatory proteins. For example, the chemotherapeutic drugs paclitaxel, tamoxifen, and cisplatin increase serum levels of sleep modulatory proteins that have been associated with chronic fatigue in cancer patients. Supportive care medications are often overlooked as major contributors to sleep disturbances. Many of the supportive care medications, including nausea medications, corticosteroids, opioids, and antihistamines, directly affect sleep. I can almost guarantee that any patient receiving chemotherapy has taken at least one of these medications at some point and may not realize the downstream effects that they have on sleep. Anti-nausea medications are commonly prescribed to be administered prior to receiving chemotherapy and for the days after to help prevent chemotherapy-induced nausea and vomiting. A side effect of almost all nausea medications is tiredness. Examples of medications that fall into this category include ondansetron, otherwise known as Zofran, promethazine, and olanzapine. Corticosteroids such as dexamethasone or prednisone are also commonly given prior to administering chemotherapy and prescribed for the days after to help prevent nausea. These medications are known to cause excitability or restlessness, which can keep patients up throughout the night. Opioids, which may be prescribed for pain, are known to cause significant fatigue, especially in those when combined with medications like antidepressants. And antihistamines like diphenhydramine, otherwise known as Benadryl, are also commonly administered with chemotherapy or immunotherapy to help prevent an infusion-related reaction. This is also known to cause sleepiness. In fact, this medication has been remarketed as an over-the-counter sleep aid medication, which we will discuss later in the presentation. Other commonly prescribed medications may also be impacting sleep. Decongestants can have a stimulating effect. Examples of decongestants that may cause excitability are agents that contain pseudoephedrine, such as Sudafed, or those that are marketed as non-drowsy formulations, such as Claritin D, Allegra D, and things like that. Be mindful of these medications and also of medications that may contain caffeine. Many headache medications contain caffeine as an active ingredient. This includes Excedrin. Caffeine disrupts the sleep-wake cycle and can lead to trouble sleeping, especially if taken late in the afternoon. Many cancer patients are also on beta blockers, which is a prescription medication that helps regulate the heart. These medications reduce the heart rate and cause exertional fatigue. Examples of these medications include atenolol, metoprolol, and carvedilol. Many over-the-counter herbal remedies, specifically St. John's wort and ginseng, are also known to cause fatigue. We'll discuss some things to look for later in the presentation. And lastly, nicotine is known to have a stimulating effect. We always think of smoking when discussing nicotine, but many patients utilize the nicotine patch during cancer treatment, and this has the same stimulating effects, which some patients sometimes forget. As discussed, many prescribed and over-the-counter medications can cause drowsiness or wakefulness. It's important to optimize the time of day when these medications are taken to help mitigate some of these side effects. Medications that are known to cause excitability, such as corticosteroids and medications containing caffeine, should be taken in the morning. Medications that are known to cause drowsiness, such as anti-nausea medications and antihistamines, should be taken in the evening prior to bed, if possible. This will help use these medication effects to your advantage. Next, I'm going to discuss some of the herbal supplements and over-the-counter products that can be used for sleep. In the interest of time, I'm only going to focus on the herbal supplements melatonin and chamomile because these seem to be the most commonly used. And as we discuss this, please remember over-the-counter sleep aids are best used for short-term to overcome a brief spout of sleeplessness. They are generally not useful for long-term chronic insomnia. Before delving into the world of over-the-counter herbal supplements and medications, I do want to mention that just because something is offered over-the-counter does not mean that it's harmless. Over-the-counter products still have drug interactions and could potentially interfere with your planned surgeries and treatments. They also have side effects which could impact your recovery. Before starting any over-the-counter product, be sure to discuss this with your healthcare team. And if you're given the okay to start an over-the-counter product, it's important that you choose a reputable brand when purchasing these products. Over-the-counter supplements are not regulated by the FDA. This means the FDA is not ensuring that the product contains the ingredients that is listed on the label. For this reason, other regulatory agencies, such as USP, looks at these products and verifies that they contain the listed ingredients and the declared potency and amounts listed on the label. When using an over-the-counter supplement, purchase products that have this USP label on them. So starting with melatonin, which I'm sure everyone has either used for sleep at one point or knows someone who has. Melatonin is a hormone that is naturally produced in the brain that helps regulate the body's circadian rhythms. Melatonin helps with falling asleep and staying asleep. Short-term use of 3 months or less is most recommended, as the long-term use of melatonin has not been established. The recommended dose ranges from 1 to 5 milligrams by mouth 30 minutes before bed. Always start low and increase the dose if needed. More than 10 milligrams at a time is not recommended. Overall, melatonin is a safe option, the most common side effects being headache, dizziness, and excessive daytime sleepiness the following day after taking it. Chamomile is also commonly used. Chamomile is an herb that is widely used in teas due to its relaxing and calming effects. You have probably seen it marketed as bedtime or sleepy time tea. There's also some evidence to support the use of chamomile for chronic insomnia. Chamomile should be avoided in those who have a history of asthma and those who are allergic to plants related to chamomile, such as ragweed, chrysanthemums, marigolds, or daisies. Chamomile does have some strong drug interactions, so always ask before starting. Specifically, it interacts with cyclosporin and warfarin and can increase the risk of bleeds, so always ask before starting. Moving on to over-the-counter medications for sleep. There are really two main ingredients that most OTC sleep aids use, diphenhydramine or doxylamine. Both are antihistamines. Diphenhydramine is commonly known as Benadryl. It's marketed as many different products, including ZzzQuil, but all have the same active ingredient. Doxylamine is commonly known as Unisom, but also marketed some different ways. These OTC products are best for short-term use. Common side effects include dizziness and grogginess. I am briefly going to mention some of the prescription medications on the market. I'm not going to go into a lot of detail because these usually need to be tailored to an individual patient and should be a discussion with your physician to determine if one of these medications would be appropriate. Commonly prescribed sleep medications include Ambien, Restoril, Lunesta, or Meltion. These medications are habit-forming and should only be used for short periods of time. Now that brings us to the conclusion of the presentation. Thank you for your time.
Thank you for joining Cancer Support Community Atlanta for this program. If you're interested in other live or recorded programs, please visit the online program tab of our website, cscatlanta.org, or follow us on Facebook. We'll be sharing additional information on upcoming programs.